So the title of our talk is Implementation of a Developmental Screening and Referral Toolkit for Preschools. These are our LEND, this is our LEND disclaimer. So LEND is supported by the Maternal and Child Health Bureau. And we'd like to acknowledge our project mentors, Vanessa and Aubin, and our faculty mentors, Charlene and Kathy. All right, so we all know that early childhood development is a smart investment. This is the Heckman equation, and this looks at, on the y-axis, the rate of return to investment in human capital. And on the x-axis, this looks at when we start to invest in human capital from the very beginning, prenatal years, and then all the way up through post-school. And you can see that the earlier we invest in human capital, the greater the returns. So our objectives were first to identify optimal methods for universal developmental screening at a community preschool in an under-resourced community, to create a screening and referral process that improves rates of developmental screening for children at a community preschool. 3, improve parents' knowledge of their child's development and satisfaction with the developmental screening process. And 4, improve teachers' knowledge of their students' development and satisfaction with the screening process. Our hypotheses are that first, parents' knowledge of their child's development and satisfaction with the screening process will improve compared to baseline. And second, teachers' knowledge of their students' development and satisfaction with the developmental screening process will improve compared to baseline.
So just a little bit about the site. So it was established in 1966 by a sorority chapter as a summer project. It is a state-funded program, and a second location opened up in 2017. So the participants of our project included all the students enrolled from September 2023 to May 2024. These are students aged 3 to 5 years old, and it also includes primary caregivers, their primary caregivers, as well as the preschool teachers at both Oak Park 1 and Oak Park 2. So the ASQs, or Ages and Stages questionnaires, look at development. The Ages and Stages ASQ 3 looks at 5 domains of overall development. And the ASQ SE2 is a little bit more specific and looks at 7 behavioral areas of social and emotional development. Typically, caregivers are the ones that usually complete the ASQs since they know their child best, but teachers and other people who see the child regularly can also complete these ASQs. Okay, so initially we started from scratch. We started in September 2023 with planning. We had an initial meeting with the Oak Park director. And then October 23, we started distributing the ASQs. We had an open house for the parents and a teacher in-service where we were able to meet with the teachers. And then in November to December 2023 is when we started providing the initial feedback. We did phone calls with the parents and emailed the results to the teachers of the children's ASQs. And this is an example of a flyer that we had for the open house. And then here are just a few examples of the feedback scripts that we had when contacting the parents. So on the left side is our initial contact in November to December, and then on the right is our follow-up for a few months down the line. And then lastly, we have these flyers. So these are learning activities for children that had any concerns with their ASQ scores. We provided learning activities to help them their daily lives. So on the left, we have an example of a learning activity for an ASQ SE2, specifically for a child at the age of 4. On the right, we have an example of a child with concerns in the personal social domain for a child 36 to 42 months. And then we felt like we were missing some information and we weren't really building connections with the community. So we started this new approach in 2024. So in February 2024, we had a teacher in service where we were able to share our goals and discuss their goals with the developmental screening process. And in January throughout May 2024, we started building more connections with the parents as well and doing on-site observations and interactions.
Okay, so I'm going to just talk about the results of our project. So again, we looked at 4 outcomes. The first was the rates of parent versus teacher completed ASQs. The second were the ASQ results themselves, which were no concerns, monitoring, or above the cutoff. The third were comparing initial and follow-up surveys of parent knowledge of their child's development and satisfaction with the screening process. And the fourth was comparing initial and follow-up surveys of the teacher's knowledge of their students' development and satisfaction with the screening process. So for the first outcome, parent versus teacher completed ASQs, we started with a total of 22 students in September, and in May we had 19 students. 5 students left Oak Park Preschools and were not included in the final results, and 2 new students joined Oak Park Preschools. So out of the 19 students, 15 had parent-completed questionnaires. 2 had teacher-completed ASQs, which were done on-site with our support, and 2 we just could never get back. For the results themselves, for the ASQ 3, 10 students had no concerns. 4 students had concerns in the monitoring zone, which basically means provide learning activities and follow up. So these were learning activities we provided for gross motor, fine motor, or personal social activities. And then 5 students were above the cutoff. And we provided these students with learning activities as well as letters of support to get special education assessment in their local school district. And 1 student who was previously diagnosed with autism received on-site behavioral support and parent coaching from Vanessa and Aurora. For the ASQ SE2 results, 13 students had no concerns, and 3 students were above the cutoff for their social emotional development. And so we provided learning activities and further assessment was recommended, but at least one of the parents declined to do any further assessment. Looking at parent initial versus follow-up surveys, overall, most parents felt neutral or knowledgeable and agreed or strongly agreed with the importance of screening and were overall satisfied with the process. But we did have a couple of outliers. We did have a couple of parents who strongly disagreed with the screening process and the importance of screening and felt dissatisfied. However, they didn't provide us actual comments about what was going on with this. We also didn't get all of the surveys back from the parents, and we couldn't directly compare individual responses. For the teacher initial and follow-up surveys, overall knowledge of student development improved compared to baseline, and teachers felt screening was important and were satisfied with the process. However, we had a pretty small sample size, so only 3 or 4 teachers at each in-service completed the surveys. And 1 teacher who strongly disagreed with screening and felt dissatisfied with the process did not complete the follow-up survey, so we didn't get her feedback. This is an open-ended survey question, which was, what suggestions do you have for improving the developmental screening process? And the parents' comments are listed in yellow. 1 parent would love it if we can track their reading fluency and letter recognition. They would love to have more developmentally stimulating activities at the preschool. 1 would love an online version for the ASQ. 1 parent felt like things were going great the way we are doing it. 16 had no comment, and 1 just wasn't aware there was a screening process. And then for teachers, 1 teacher thought the process was good and it helps them understand how to better help the kids. Another teacher wanted all the materials given at once for the screening process, so for it to be more organized, and just 1 left it blank.
So we did face a few challenges with the project. One of the biggest challenges was the time lag and lack of engagement overall with the community. We had a lot of missing forms initially. We also had a lot of hard times connecting with the parents and the teachers, and we felt that we lacked teacher feedback and clarity of goals and lacked connections with both the parents and the students. And overall, we felt like we were missing the whole picture. So some of the solutions included sharing the goals with teachers at the in-service meeting in February. We also increased overall on-site presence. So this improved communication with the teachers and we were able to connect better with the parents. And we felt like we were able to get a clearer picture of the students through behavioral observations and interactions. We also struggled with having some cultural differences. Some parents or teachers expressed fears of labeling, or they had different views on normal child development, and overall different views on the pros and cons of developmental screening and the special education services. So some solutions for this was to open dialogue with the parents and teachers. And in the future, we'd like to explore cultural perceptions around normal development and screening, and align with the parents' goals for their children to understand what they want out of this screening process, and also provide plain language letters when providing letters of support. So overall, to improve sustainability, it's important to develop shared goals and expectations for developmental screening and services. It's also important to be very organized, such as planning visits and training roles, keeping materials organized and accessible, and providing timely feedback. Lastly, it's very important to identify ways to actively engage and support teachers, parents, and students throughout the screening process. Okay. And then overall conclusions to our project, we found that face-to-face contact is a key component of universal developmental screening at a community-based preschool. It helps build rapport and provides a clearer picture of overall behavior and development, and it was a lot more fun. Second, the developmental screening and referral process should include a shared timeline of goals, organized materials, and active teacher and parent engagement. Third, the parents' knowledge of their students, of their children's development and satisfaction with the developmental screening process was improved, but had a couple outliers. And lastly, the teacher's knowledge of their students' development and and satisfaction with the screening process improved, but it was overall a very small sample size. All right, and that concludes our presentation. So these are the references that we had for our literature review.
The UC Davis Mind Institute was founded in 1998 with the promise to reduce and prevent the disabilities that can be associated with autism and other neurodevelopmental conditions. Every day, our clinicians and researchers make progress on that promise. Our groundbreaking research on autism, Fragile X syndrome, chromosome 22q11.2 deletion syndrome, ADHD, and other conditions associated with disability are helping affected individuals achieve their fullest potential. Please visit our website or our social media platforms to find out more about current studies, upcoming events, and how you can help make a difference.